And good evening now. Thanks for being with us. I'm J.R. Berry.
And I'm Darcy Strickland. We're going to begin tonight with new legislation out at the State House.
A bill that could make birth control more accessible is making its way through the House of Representatives. As Julia Kaufman reports, the measure received widespread support from women, doctors, and pharmacists today.
I support this bill because I know what it's like to not have access to the health care you need.
Senate Bill 628 could allow women 18 and over to get birth control from a pharmacist without a doctor's prescription. It passed the Senate unanimously and has now passed this House subcommittee. Columbia resident Courtney Thomas says hormonal contraception has helped curb symptoms of a condition she has called PCOS.
So when I felt cramps that sliced through my back and midsection, I thought it was just part of being a woman.
But when Thomas's doctor is booked up, it's hard to schedule a time to go in just so she can get a new prescription. This bill would prevent that problem.
This is about trying to make sure that women have more of an opportunity to have access to contraceptives than they currently do.
Representative Russell Ott says in rural areas like his county, doctors are harder to come by, making birth control harder to obtain.
Those pharmacists, Representative Johnson, that you are very well acquainted with, you know, that's that first point of contact to a lot of folks. And there is a relationship that is built with pharmacists that, is built on trust.
Concerns were raised that the bill could lead to women seeing a doctor less often. But Dr. Dawn Bingham says annual OBGYN appointments and cancer screenings like the Pap test are not required for contraception.
Cervical cancer screening is not actually recommended annually for most women. It's actually 3 to 5 years for most women.
The bill allows pharmacies to opt out of offering contraceptives directly, and lawmakers say the state's Board of Medical Examiners is developing protocols for pharmacists so they can administer it properly. At the State House, Julia Kaufman, News 19, WLTX.
Well, if that bill becomes law, pharmacists would be trained by the Board of Medical Advisors, and women would need to fill out a self-screening risk assessment before getting the hormonal contraception.